Hello, my name's Annie. I first went to the Murrayfield in February 2011 for my first hip replacement, and then I went the following year in May in 2012 for my second hip replacement. Obviously, going to have such what I thought at the time were very major operations, I was quite nervous about it. But as soon as I arrived in the hospital, the staff were very nice, and I felt relaxed, partly because I was coming into an environment that was surrounded by countryside, and I could relate to that. I'm an environmental consultant, and I enjoyed having trees around and the gardens, and people treated you as an individual, and I liked that. I was obviously nervous going to the hospital. I didn't really know what it would be like. I went for my first visit to see poor Gaston, and I hoped he would give me a pill and tell me I could go away. But as soon as I met him, I realised that he was very professional, and I had every confidence that he would look after me very well. I had had a condition in the past, and there was a little bit higher risk with this, but he said, "Don't worry about it, we'll deal with it, and if anything happens, I'll look after you." And I really did feel confidence in what he was saying. He examined me and told me that I did need a full hip replacement. There were no other alternatives that were suitable for me. And then we had to decide when it was going to happen. And at this point, he didn't actually give me any choice. He said I needed to go in immediately because it was in very bad condition. And that suited me fine. I had no time to worry about it. But at the same time, I had the opportunity to put my work affairs in order. I'm a consultant, and I had to make sure that my clients were happy with me having time off. And that worked very well. When I went up to have my operation, I didn't feel nervous. I felt as though at last something was beginning to happen. Everybody was very, very kind. They were very, very encouraging. I had a spinal injection. I didn't have a full anaesthetic, although I had said I didn't want to remember the operation. And the anaesthetist just seemed so professional. I had no anxiety at all. I felt confident that everything was going to go well. And the next thing I knew, I woke up in the recovery room and was chatting away with the staff there, who were all very friendly. The second time they were talking about the sweets they ate when they were little, and I was able to take part, and we all had a good laugh. But the biggest thing of all was the pain had gone each time. Even though I still was quite numb, the pain had gone, and it was just a different experience, and I just felt overjoyed. Genuinely, both times it was a completely life-changing experience. I went from not even being able to walk from our house to the bus stop, which is only less than 100 yards, without my husband's help, and being at a point where everything was extremely painful, and I couldn't even sleep through the night. I sometimes woke up every hour, and I went to being virtually pain-free. Okay, there was some recovery time, but that was nothing. I didn't find that difficult at all. Soon I was out of bed and in starting to recover. I knew that was important, and it meant a lot to me that I kept mobile, and the physios had me out of bed almost straight away, and I was on the path to recovery. And in both cases it was a really life-changing experience, and there was never a feeling of illness. And I think that's one of the things I've learnt most with a hip replacement is people talk about it being a major operation, but actually when you have it done, it doesn't feel like a major operation. It just feels like a life-changing experience that gives you new opportunities again. My husband and I, what we really enjoy doing is walking in the hills, we like gardening, and it's fantastic to be able to do all those things again, to be pain-free and to enjoy being out without thinking about whether you can manage the walk because of the pain. My job as an environmental consultant means that I'm often out in the countryside on peat bogs, climbing gates, climbing fences, and it's wonderful to be able to do all those things again. It really has been a life-changing experience, and I'm very appreciative for everything that's been done.